Hello everyone, my name is Patricia Tooker and I am the Dean of the Evelyn Spiro School of Nursing. I'm delighted to be here with all of you, family, friends, colleagues, co-workers, faculty, students, to celebrate a wonderful, wonderful event. Our students have completed a terminal degree, as we call it, a terminal degree. Not much more to do after this, although I would suspect some of you will find something else to do. But this is our fourth cohort. This is the fourth graduating class with the doctorate in nursing practice. Wagner historically did not have any doctoral programs until 4 years ago, when the School of Nursing put forth the DNP, the doctorate in nursing practice. And even though many of you may have labored through the 2 years and 3 months along with your loved one, you may not know actually what a doctorate in nursing practice is. So I'm just going to tell you very briefly. You know what a nurse is, and you know what an advanced practice nurse is, because the 8 graduates coming up here tonight are all family nurse practitioners. So they have been practicing at an advanced level for quite a while. And then they decided to take that even a higher notch. And they did that because the demands of providing health care in our community and in our country is increasingly complex today. And it's increasingly complex for populations of patients that require higher levels of nursing care. So when you think of going in, if you have a little cold, to a healthcare setting, then you're going in for sutures if you cut yourself, and then you're going in for surgery. As the demands get higher, so too does the care that needs to be provided. So this is a higher level of nursing education and practice. It's a practice-based doctorate. There are PhDs, there are DNSs, Doctors of Nursing Science, there are EDDs, educational degrees. There's a variety of terminal degrees. But this is a practice doctorate, meaning all 8 candidates are practicing somewhere in the healthcare setting. So we need this higher level, and this has emerged to address the need to provide this higher quality care, if you will. We've done it to apply the evidence-based practice. We want to see what the research is telling us. And then we take those findings and we apply them to the populations that need the care that we are giving to them. So there's an emerging model, a generation of knowledge by both the research and the practice nursing doctorates. So the folks that are doing just the research coming together with the folks that are practicing, taking that research and practicing, and together we're building these teams in the healthcare arena to provide the highest level of care that you all deserve, that everyone deserves. So non-clinical roles or indirect care for advanced nursing practice and their traditional roles of research practice benefit from these competencies that are attained from studying to be a doctorally prepared nurse. So tonight we honor our DNP students, our graduates. We honor and we recognize their accomplishments. They have completed a program of academic rigor, yes, including the biostats course that the class is taking their final right now. Academic rigor and scholarship, which is evident in their projects that you are going to just see a snapshot of. You're going to see a 5-minute snapshot tonight of a 2-year, 3-month ordeal. But it's these projects that recognize and may even result in major contributions to the profession because of their doctoral level work. So tonight I applaud you. I welcome the families. I hope that you will celebrate. I hope you will come back in May to our commencement ceremony where you will be hooded with your doctoral hood and continue to take the work that you have done in our program and please infuse it into the population that you've worked with. Get it into an organization or a community health setting. Make sure it's sustained because you've done great work that I know will change the lives of many. Without any further ado, and trying to keep to our schedule, I am so pleased that Dr. Joel Martin, our new president, our 19th president of Wagner College, has been able to carve out a little bit of time to join us tonight and to welcome all of you. Dr. Joel Martin.
Thank you, Dean Tooker, and welcome to all family members here and friends who supported these students in their advanced degree, their terminal degree. I hope you're really proud of your students, of your colleagues, and I hope you who have done this degree are really proud of yourself. I know that as president of Wagner, I'm very proud of you. It's a real mark of distinction for a person in scholarly study to get a PhD, an EDD, a DNP. Any terminal degree in any field is the pinnacle of learning and research. And I admire that, I respect that. I'm not surprised that the first doctorate, and the only doctorate at Wagner to this point, is in the School of Nursing. The School of Nursing here has a distinguished history. I've been reading a book by a colleague. What's the name of the author?
Margot Governo, Dr.
Yes.
Margot Governo.
Dr. Margot Governo. And it's about Mary Burr, who founded the School of Nursing under President Staunton in 1943. And you know, it's just a wonderful history. I really commend it to you. She did this book as an EDD at Columbia. And the history of this school is so impressive. It was partly out of patriotism that this school came into being during the war. We needed nurses. And so the state of New York commissioned the study, and President Staunton reached out and helped carve out and create the School of Nursing, recruited a dean. Her name was Burr, Dean Burr. And her vision was a comprehensive vision. It wasn't just a local, let's try to address a tactical need. Let's think long-term about the profession of nursing, how we cultivate the best possible nurses, how nurses gain high respect in hospitals and all healthcare settings. She gave doctors some grief, in all honesty. She would not let her nurses be disrespected. She admired the expertise that they brought into care. And she said that it was important for us to have a research approach to nursing, to be an evidence-based approach to nursing. She wanted us to have a liberal arts foundation to nursing, and that's what we prize here at Wagner. So we created the School of Nursing in 1943, and it has just grown and flourished, and now we have another great new dean, Dean Tooker, who's helping to lead us forward. I'm not at all surprised that the School of Nursing is the one that has the first and only doctorate at Wagner. It may not be the last, and who knows, we may develop some more on the model of what you've done here. But I'm very proud of you as the president of this wonderful institution, Wagner College, that you are representing us at the highest level of research possible in a field through the work that you've done over the last 2 years and 3 months under the good stewardship of our faculty, Dr. Ahern, our Dean Tooker, and other faculty. So congratulations, heartfelt respect and pride in what you have accomplished here. Please let everybody know as you go out and you change the world and you make a difference that you are a proud graduate of Wagner College and you're an alum of Wagner College. And we all do hope to see you at the commencement. It's a really distinct honor to be robed. It's the epitome of what it means to be a learned person. I really commend that you do that ceremony as well. But tonight, we're here to hear from you, and so congratulations.
Thank you so much, Dr. Martin. I think Dr. Cherofsky is going to return to the podium and begin with some of the, with the presentations.
I just want to tell the audience that Lee Manchester, which is our in-house photography person that we adore, is sitting right up here, will be videotaping the whole ceremony. He's already started, and we'll be taking photos of all the graduates that come up to receive their certificate. So please don't feel the need to, he will have all of this up on the Wagner website or email them to the students directly by Tuesday or Wednesday of next week, because he happens to have something to do tomorrow, which is very rare because Lee works 24/7 for us. But we are so happy that he was here to be able to do this for all of you. So I just wanted to let you know that, so no worries. I'm going to begin my name is Dr. Nancy Cherofsky. I'm the DNP coordinator, which means that I have gotten to know each of the graduates. I may have known them prior to undergrad or their graduate work, but many I didn't know, and I get to know them really personally, and I'm really proud of all of you. So I just wanted to tell you all of that and wish you the best always. And you're a really great group. And you're a very cohesive group as well. You're very supportive of one another, which I think says a lot about all of you. And you're a very diverse group, which is even, I think, more important, that your support for each other is genuine. I just will call each student up. I will hand you your certificate, and I also ask that you speak 5 minutes or less about your capstone project, about the work that you've done, and then after we're done, Dr. Ahern will then be the next speaker. Okay? So I will begin. The first student I'd like to call up to hand her certificate and to give her best wishes on behalf of the nursing program is Marianine Ade. Marianine has 4 boys. She works full-time. Amazing woman. They're all amazing women. Just amazing.
Thank you so much.
Congratulations.
Thank you so much.
Two shots.
I'm very happy it comes to an end. I'm Marianine Ade, and I'm very, thank you for everybody for being here. And my project, I worked on an interventional program for nursing students to improve communication, their communication when caring for lesbian, gay, bisexual, transgender, and queer population. It's a video. I created a video with interactive avatar, and the goal is to improve communication among nurses, nursing students, because they're gonna be the forefront staff out in the healthcare facilities and world. And the goal is to eventually see that this type of video is being used in the nursing curricula, because when I did the literature review, there's a big gap. They haven't had, there's a need for the education. There's a need for the education in nursing schools and medical schools, and then almost every single discipline. I want to thank Dr. Ahern and Dr. Cherofsky, and especially Dr. Tucker for the journey since nursing school, master's to DNP, and not to forget all the faculty members who've been supporting me for the past, I would say, 2.5 years or 3, and my master's. And I also want to thank my mentors. They've been around forever, Dr. Cruz and Dr. Najee Cruz and Dr. Claire Cruz, for supporting me all those years. And I couldn't ask for anything more. Beautiful, beautiful professional women that we've been hugging and working this journey together. And my colleagues. And I also want to thank my children. They've been very supportive. They have to clean, cook, and then I hope that doesn't stop. Congratulations to all my colleagues, and then thank you very much.
Congratulations.
Thank you so much. Should I stay here?
No, you're good. You're good.
Okay.
The next DNP graduate I'd like to call up is Sandra Blandon. Sandra is a mother of 2 children and just recently had a grandchild just a few weeks ago.
So my name is Sandra Blandon. I'm a family nurse practitioner. I've been a nurse practitioner for about over 30 years. The last 2.5 years has been great, challenging. So what I did is I work in the community health center, and it's federally funded, so it's for unserved population, basically immigrants that undocumented. So my project was on knowledge and perception regarding disaster preparedness among Hispanic population on Staten Island. So what I did is I developed a survey at my center, and my results were basically consistent with my literature review that showed that 76% of the Hispanic population just on my center were disaster prepared. And if you look at the regular literature review, it says about 60% of Americans are not prepared, okay? I didn't even know what a disaster kit or emergency kit was until I started this program. So my plan is to develop an educational program at my center to help my patients in a disaster. And it doesn't have to be a hurricane or anything. It could be a snowstorm, no lights, nothing. We all need to be prepared. If we're a little more prepared, we can help ourselves and our families. I have to thank my family. I'm going to get emotional. And my best friends of the world. They were my proofreaders for my project. And I have to say that I have to thank a mentor all the way in Oklahoma City, where she did, and she's published a book on regarding tornadoes in Oklahoma City, because they're more prone to that than we are, on Hispanic population. And I'm hopefully glad I'm going to see her next year to try to do something. But thank you, my family, my friends. Thank you.
The next DNP graduate is Dr. Kathleen Caridi. She's a mom of 2 children. She has 4 grandchildren and 1 on the way, correct? Right?
Yeah.
We got to step. Yeah. Okay.
Hi, so my name is Kathy Caridi. I'll talk a little bit about my project, but before I start that, I want to say that this definitely was a labor of love, and it definitely was a labor of a cohort group. I think that the 7 other women that I'm graduating this program with are enormously inspirational and enormously talented in their own way. Each one brought something to our cohort that I didn't have. And I think, we really learned from each other, we really supported each other, and I really feel like I found friends for life. So I really want to start with that, just in case I forget. I don't want to leave you guys out, because it's been amazing. I wouldn't have been able to do it without them. So my project was on, and it's an interesting topic, and it's a fun topic. The name of my project is Navigating the Weeds, which discusses medical marijuana, or you guys can figure out the title from there. My goal for the project was to see what the knowledge deficit for providers were, and during a literature research, we can see all along the research that doctors, nurse practitioners, or healthcare providers are not educated enough on medical marijuana to feel comfortable enough to provide the information that our patients are demanding. So the purpose of my project was to introduce I did an educational tutorial, a caricature tutorial for nurse practitioners with basic information about medical marijuana to see if it would pique their interest, increase their knowledge level, and more importantly, increase their comfort level to discuss medical marijuana with their patients that come in asking these questions. So I'm really excited about the project. I think the long-term goal for it is to work with curriculum organizers and curriculum staff to see if we can implement something within the advanced education department, like the nurse practitioner program or the PA program, or certainly in the medical schools, to make sure that all healthcare providers are educated on the endocannabinoid system, pathophysiology, anatomy and physiology of the system that really interacts with medical marijuana. So that was the motive for my project. The other people I want to certainly thank is the coordinators. I've had some great support with certainly Dr. Ahern, for sure. It's been rough, but it's been good. We've gotten through it. And certainly the other coordinators, and most importantly, I really do feel like I need to take this opportunity to thank my husband. He's been an absentee, I've been an absentee wife for the last 2.5 or so years, so I really appreciate his support, my children's support. I'm not the grandmother that's babysitting all the time. I've got a lot of things on my plate, so I really appreciate the support of my entire family, my sister, her husband, my aunt, who's my proofreader, and all family members that are here tonight. I really appreciate that. So thank you so much.
The next DNP graduate is Dr. Caitlin Griffin. Caitlin is a mother of one little girl who's in the back there, adorable, looks like her mom. I'm happy to present this. Congratulations, Caitlin.
Hi, my name is Caitlin Griffin. I don't know how to move this. I'm a family nurse practitioner. I work currently over at NBC Studios. I did my project on preparing for, really to assess the needs of first-time fathers that have experienced an unplanned event that caused them and forced them into the role of sole caregiver. So basically my research went to try to identify the needs of this group and realize what it did was it just showed, it highlighted that there was a need, and we're hoping that really in the future we could put this out there so that really more prenatal care, more education can start in the prenatal period. So I just want to thank everybody in the program, all of my classmates, and then I also want to thank all my family for being so supportive and patient. So thank you.
The next DNP graduate is Dr. Jennifer Macchiarola. Jennifer is a mom of twin boys and adorable twin boys. And she'll be speaking about her project also. Congratulations.
Thank you.
I probably don't need a microphone, but I'm very loud. Before I start, I want to thank everyone for coming out tonight, but most importantly, my family, my mom, my dad, my mother-in-law, my husband, and my 2 children, and my friends, and my cohort who got me through this. Dr. Ahern, you're a lifesaver. I always counted on you all the time through all my emails, and all the faculty that made this possible. It's an honor to be here tonight. My project dealt with a very important topic, and it was something that I did here on campus, and it was preparedness training for college students to increase survivability after mass casualty events. And unfortunately, that's something that's happening all too often. What I did was I created an educational module, and I named it BCAT, and I'm in the process of copywriting it. It stands for bleeding, control, compressions, and tourniquet training. And what I did was I disseminated this program to the college campus here. I used students that had little to no education as far as medical training. And I did biofeedback simulation with the students, including an educational piece. And we went into classrooms, and we had the students do simulation and drills, and we wanted the students to be prepared. So the 3 kind of events that we used, one of them was active shooter event, which unfortunately can happen here on the campus. Another one would be a weather-related event, and then the third one was a gas leak in a campus hall. So with that in mind, the students came out with 50 to 70% increase in their test rates, and also 100% competency level. So my results were really great. And in the future, I will hope that I will bring it down a level. I want to bring it into high schools because my sons, AJ and Michael, will be starting high school. So I would like to do this educational program in a school, high school, and even into intermediate schools, because I do believe that this is a very important issue that we have to be prepared. So again, thank you. And it's an honor to be up here tonight, and I'm very happy to be a doctor.
The next doctoral graduate is Dr. Christine Mavaro. Christine is a mom of 3 children. 4, I'm sorry, 4. Okay, I'm sorry, I don't want to, I only see her 3 children in Target at night. 11 o'clock, me and Christine meet in Target. So I'm sorry. I probably don't see your son, right? No, that's why, I'm sorry. Come on up. Christine works with children at NYU in cystic fibrosis. She was actually the first nurse practitioner in the cystic fibrosis area after she graduated here from Wagner. So that in itself was a big deal. So congratulations, Chris.
One more.
So my name is Christine Mavaro. I'm an FNP at NYU Cystic Fibrosis Center. I did my project, first of all, I want to thank the faculty and my family, friends, especially my family, who has been really supportive throughout this whole endeavor. And today is actually bittersweet for me because although, you know, I'm graduating, I developed really great friendships. I'll get emotional, and it's bittersweet because I'm hoping that we all keep in contact. I met friends for life here, so I really, I'm gonna hopefully see them all the time. So I work with kids with cystic fibrosis at NYU, and when I first became a nurse practitioner, I realized that the young kids were very anxious. So I decided to do a QI project on the assessment of anxiety in children ages 6 to 9 with chronic disease. And the rationale for that is that kids with chronic disease are at high risk for depression and anxiety. So, you know, as healthcare providers, we all see the push out there for adolescents and adults to better address the mental health needs of patients, but kids are not at part of that. So I developed a QI project, and I created a feelings journal, a assessment tool to identify kids that have anxiety symptoms. So what I did was I surveyed the parents first, because working in a pediatric center, you always have to involve the parents. And then I gave this tool, the tool I created with my NYU Cystic Fibrosis CF team. We worked, the mental health team, myself, social worker, we developed this tool. And when I started it, I thought there would be some children with anxiety, but after we calculated all the results and did it, 10% of children in our clinic had had 3 symptoms or more of anxiety. 100% of the children had at least 1 symptom of anxiety. And on the other hand, parents rarely thought that their kids had any symptoms of anxiety, and thought their kids were interacting with their peers. And you know, we obtained a lot of, even though it was a small sample size, we obtained a lot of information that we should be addressing kids for mental health issues at an early age. So, and again, I want to thank everyone. I want to thank Dr. Ahern, Dr. Cherofsky, who were really supportive and really pushed me to do the DNP program, and of course the other faculty that I've worked with in the past. Thank you.
The last but not least doctoral candidate that's graduating is Dr. Kimberly Valdecantos. Kimberly is the youngest of, well, I think, all of the graduates, and adorable. And I think maybe some of the older graduates took her under their wing, and you can see how adorable she is. Congratulations.
Good evening. My name is Kimberly Valdecantos. I would especially like to thank all the faculty here at Wagner for guiding me throughout this whole endeavor, especially to Dr. Ahern and Dr. Cherofsky for taking me under their wing and for getting me through this program. It was not easy, but they helped me a lot with this project. Especially thank you to my parents, my brother, and to all my friends that are here right now. I'll be back. my social life again. So the title of my project is Body Image Assessment in the Post-Bariatric Surgery Patient. So body image is not, or just really, mental health is not checked post-surgery. So I wanted to assess the body image in post-bariatric surgery patients. So an online survey using the body uneasiness test was assessed and dispersed through social media in Facebook, Instagram, Twitter, and Reddit. Results of this study had showed that perceived body image remains poor even after bariatric surgery. A majority of my participants in the study had no weight regain, but yet they still had poor body image. There was no statistical significance between gender, and there was no statistical significance between the participants that had weight regain or no weight regain. What was significant was that participants across the age groups from 18 to 45 and over showed clinical significance of body uneasiness even after bariatric surgery. Even more so when we did further analysis that patients or participants that had participated showed clinically significant and statistically significant scores that showed body image was perceived as poorly even after surgery. So this just shows that no matter what the surgery is, whether it be gastric bypass, LAP, or gastric sleeve, that body image and mental health assessments needed to be done after surgery and throughout the journey, not just pre-op, post-op, but it has to be done throughout their lifespan, because there was one literature that showed that even after 10 years, body image remained poor and even deteriorated even further without any mental health assessment. So it just shows that mental health screening is necessary and should be done throughout the bariatric surgery's lifespan and their journey. Yeah.
I'd like to introduce Dr. Kathleen Ahern. She's our graduate director and our doctorate director. She's going to speak and give out an award. I'd like to also just point out there are programs to tonight's event over where Dr. Olorales is standing. So if anyone hasn't received a program and like to take one home, please help yourself after we're done, okay? Thank you.
You know, I feel like I've had a very long pregnancy with getting everyone through these, through the DNP, through the project. I would just like to say, just very briefly, this DNP program actually focuses on disaster management and on population health. And we really started thinking about it back when Katrina hit, and we thought about that, and we thought about how students were nurses and doctors and other healthcare professionals were not prepared to function in a disaster. So even though an individual student project may have focused a little more on population health rather than disaster, the whole program prepares these individuals to function in a disaster as a leader. And now I would like to tell you that I am so honored to present the Samantha Reinhardt Esposito Award. Samantha was a graduate student. I was her professor, her program director, and she passed away due to an illness that had really affected her from childhood. In the past year, she passed away. But This award is a celebration of her life. And this award is given to a Doctor of Nursing practice graduate that has exemplified professionalism, compassion, commitment to improving the lives of individuals and communities, as well as scholarly achievement. And it gives me great pleasure to present this award to Christine Mavaro. She didn't know anything about this, and nor did anyone else. And I would like to say that each year we will be giving the Samantha Reinhardt Esposito Award, and the student we pick will differ in terms of what they focused on, but this year, because Samantha, her area was really pediatrics, and that was one of the reasons that we wanted to select a student who really did focus on improving the lives of children with chronic illness. Okay? And this concludes our ceremony, and I would like to say to all the families and everyone else that is here, thank you for being here. And also to the graduates, I am so proud of each and every one of you. I demanded excellence, as you know, and maybe wasn't always that happy about my demands. However, I truly believe that you have achieved excellence tonight. So please enjoy some more refreshments. The refreshments are still out there, and have a wonderful holiday.